What if I told you that the normal testosterone levels you've been hearing about might not actually be normal for you? Hi, I'm Dr. Lisa Sabrina, urologist and pelvic surgeon. Today, we're breaking down the science behind testosterone levels, what's considered normal, why it varies, and how it impacts everything from bone health to fertility. If you've ever wondered whether your testosterone levels are where they should be, keep watching. I've had patients come into my office confused, frustrated, and honestly, a little angry. They get their blood work back, see they're at 310 nanograms per deciliter, and their doctor says, "You're fine." But they don't feel fine, and there's a reason for that. The current guidelines we use are a bit oversimplified. Let's start with the basics. Guidelines such as those from the American Urological Association recommend 300 nanograms per deciliter as the lower limit of normal, while European guidelines suggest 350 nanograms per deciliter. But here's the thing. This one-size-fits-all approach doesn't account for the fact that different organs in your body need different levels of testosterone to function properly. For example, in the Testosterone for Diabetes mellitus trial, published in The Lancet, participants were enrolled to receive testosterone replacement when they had a total testosterone level of less than 440 ng per deciliter. Researchers found that those who received testosterone experienced a significant reduction in their risk of developing type 2 diabetes. Even more interestingly, that same group showed improvements in bone density and structure, suggesting that bone health might require higher testosterone levels than, say, sexual desire. However, the science is still not clear on whether testosterone therapy actually reduces the frequency of bone fractures. When it comes to fertility, reproductive specialists typically aim for testosterone levels between 600 and 800 nanograms per deciliter, which is much higher than the so-called normal range. Another thing to consider is how quickly testosterone makes a difference in your body. If you're looking for improvements in sexual desire or mood, you might notice changes within weeks of starting treatment. But changes in muscle mass and bone density can take much longer, often requiring higher and more sustained levels of testosterone. And speaking of improving sexual desire, I have a free gift for you. If you'd like to get my top 10 evidence-based tips for enhancing pleasure, check it out at www.reenamalikmd.com/morepleasure. Now, let's talk about age. Is a 300 nanogram per deciliter cutoff appropriate for a 25-year-old? Probably not. Younger men may need higher thresholds to maintain optimal health. Researchers are now suggesting age-specific ranges to better tailor treatment. I've made a prior video covering these age-specific ranges, so check that out to learn more. Lastly, your sleep quality, something I've talked about before, has a huge impact on your testosterone levels. Even if your numbers are technically normal, improving your sleep can lead to significant increases in testosterone. Your body produces most of its testosterone during deep sleep, as part of your natural circadian rhythm. So if you're not sleeping well, you're fighting an uphill battle. No amount of treatment can fully compensate for poor sleep. So what's the takeaway here? Your normal testosterone level shouldn't be defined by a single blood test number. Instead, it should be based on your individual needs, whether that's bone health, fertility, or overall well-being. Now, just to clarify, if you're trying to conceive, do not take testosterone replacement therapy. It can actually suppress your fertility. But there are off-label ways to improve fertility, and I've discussed those in other videos on my channel. Also, testosterone is not a cure-all for every issue in your body. It can help if you're deficient for your individual needs. However, if your testosterone levels are already normal, taking more won't improve bone health, fertility, mood, or sex drive. That said, I firmly believe that personalized treatment is the future. Understanding your unique testosterone requirements can help prevent long-term issues like muscle loss, bone density problems, and other future health risks. If this video opened your eyes to how testosterone really works in your body, subscribe, because I'm here every week diving deep into men's health topics most doctors don't talk about. And hey, share this video with someone who might benefit from understanding their testosterone levels better. And as always, take care of yourself, because you're worth it.